So, what brings you to the office today?
My eyebrow transplant.
Eyebrows. Okay, very good.
Right after COVID, I got diagnosed with a condition called hyperthyroidism. One of the side effects that has is that you start losing a lot of hair. I had a couple of spurts here there a few years back, but now they're completely gone. There's there's maybe 1 or 2 or 3 hairs, if you can see that. So and now it's like, I need this badly.
Here you can see donor hair extraction. This step is the extraction of hair follicles from the donor area, which is usually the back of the patient's scalp. We use a specialized tool to extract individual hair follicles from the donor area, and it's important that these hairs are extracted one at a time and placed in a solution to keep them healthy and viable. Next is the preparation of the transplant site. Here you can see us making little incisions into where each hair follicle will be implanted. We carefully design the shape and the angle of the eyebrow to ensure a natural looking result. This patient is wide awake and under local anesthesia, which means anesthetics were injected into her eyebrows and she is feeling no pain. As you can see in some of the clips, she's actually smiling and having a good time. Once the transplant site is prepared, we will carefully implant each hair follicle into the little incisions. It'll be important that we place the hair follicles at the appropriate angle and the right direction to mimic the natural growth of eyebrow hair. During the first 2 weeks after the procedure, the transplanted hair follicles will begin to heal and settle into their new locations. Some of the transplanted hairs may fall out during this time, which is normal and expected, so don't worry. Over the next 3 to 4 months, hair transplanted follicles will begin to grow new hairs. Initially, the hairs may be thin and wispy, but they'll gradually become thicker and more noticeable. Patients may start to notice some new hair growth around 3 months after the procedure. And at 8 to 12 months, the majority of the transplanted hairs should have grown in, and you'll pretty much have a good idea of what the final result will look like. The hairs will continue to mature and thicken over time, and patients can expect a long-lasting result. If you're looking for hair transplant to the head or to the eyebrows, contact Dr. Katzen's office at 310-859-7770, and we'll get your eyebrows looking on fleek. Does anyone say that anymore?